The future of healthcare innovation begins with powerful conversations. JV EdTech Medivation, in collaboration with Power of Knowing Forum, proudly announces a healthcare podcast series focused on the future of healthcare innovation. This next-generation podcast series explores hospital systems, medical technology, AI in healthcare, and innovation, bringing together experience, expertise, and meaningful dialogue. The series delivers real-world, actionable insights from global healthcare leaders, moving beyond theory toward practical implementation and impact. Beyond theory, this podcast series focuses on real impact by bringing actionable insights from global healthcare leaders, doctors, and technology innovators. The conversations cover key areas such as AI in healthcare, telemedicine, smart hospitals, and emerging medical technologies that are shaping the future of healthcare systems worldwide. Medical schools, healthcare institutions, students, faculty, doctors, and healthcare professionals from India and across the world are invited to be part of this journey. Backed by Power of Knowing Forum's 300-plus episode legacy and aligned with global standards, the series offers structured, easy-to-understand learning for both executives and learners. Our shared vision: make healthcare knowledge accessible, innovative, and impactful. Encourage global collaboration in healthcare education and technology. Empower the next generation to listen.
A very good evening to one and all. Today, once again, it's my privilege to host one of the renowned speaker today, and the topic is building leadership for promoting quality, patient safety, and embracing AI and innovation for the next generation. It's a MedTech Insight Podcast 9 with the JV Tech Innovations and the Power of Knowing You Forum Collaborative Health podcast series. Once again, I welcome everyone. It's my privilege to welcome today our guest, renowned India's most respected voices of the healthcare quality, patient safety, and the transformational leadership. Dr. Vijay Agarwal is a distinguished pediatrician, healthcare strategist, and the president emeritus of the Consortium Accredited Healthcare Organization CAHO. Over several decades, he has championed quality improvement, patient safety, clinical governance, and leadership development, helping shape India's healthcare quality movement. He believes while technology continues to transform healthcare, trust, compassion, and leadership remains a true foundation. Today, we explore his vision for the future of healthcare in the era of artificial intelligence and the digital transformational and unprecedented changes. Here, we welcome Dr. Vijay Agarwal. Thank you so much, sir, for being with us.
So, good morning, good afternoon, good evening, depends upon which part of the world you are just joining us from. So, thank you very much for this invitation, Jyoti ji, and I'm very, very obliged. I bring you greetings from Kaho. And this conversation is, I think, very, very important and at a very important point in the journey of healthcare, I'll say. So, I'll say that. I joined medical school in 1964 and I'm now entering the 80th year of my life. So over the last so many decades, what we have seen is that healthcare has been transformed and there have been tremendous amount of advances, especially in the diagnosis and treatment, with antibiotics, vaccines, intensive care, transplantation, minimally invasive surgery, imaging, and they have dramatically improved outcomes. They have improved life expectancy. But now we are entering a very, very different era. So it's going to be a very exciting and a very different decade in which the focus is going to be shifting now on, I will say, prevention, early diagnosis, making patients as the partners of their healthcare, personalizing care, and all this with the help of AI, genomics, robotics, digital health, and connected care. So, I mean, this is going to be naturally a very exciting time. But we must remember that in spite of all these technologies, healthcare is for people and being delivered by people. And I think technology should only strengthen this relationship, not replace it. For me, the future rests upon four pillars, I will say, that is humanity, reliability, intelligence, and leadership. And when I say intelligence in today's date, it's now the human intelligence combined with the artificial intelligence and even combined intelligence. So, if we combine these four pillars very nicely, I think we can redefine the healthcare delivery for the future generations. So, thank you and over to you.
Yes, absolutely, very well mentioned. Your experience and definitely the moment which you have started, okay, with the Kaho, it has been really a great initiative, I must say that, for all the healthcare professionals, not only in India, but even the globe. So let's start the podcast today. The very first question goes: what defining shift will shape the healthcare over the next decade? Over to you.
So, as we were talking, that healthcare has always been evolving, and a few of the shifts are very visible even today. The patient-centric care is coming into picture. Diagnostics, which were like now high tech and technology, high tech medicine, which was confined to some handful of the top centers, are now being available and are spreading very fast. Home care and the remote monitoring is becoming quite a bit of a norm. So all these shifts are very much visible. The quality in healthcare is now becoming quite measurable, visible, and rightly under the more scrutiny of, I will say, patients as well as payers, regulators. All that will happen, and I feel that the next decade will accelerate all this and will accelerate at a very, very, I would say, alarming kind of a speed. Again, with the help of AI, machine learning, robotics, genomics, and all these will reshape how we predict risk, how we choose treatment, prevent harm, even run our hospitals on a day to day basis. And I genuinely feel, in fact, that we are moving towards an agentic physician with a co-pilot on his side, and I feel that in if you look at the kind of problems that the community is facing today, where especially in Western countries, people not getting an appointment for 2 weeks, 3 weeks, or a couple of months. Why should anybody wait for that? And that's where these agentic physicians are going to be very, very helpful. Even I will say robotic nurses and doctors are going to be something which may be only a few years away, not decades. And a lot of these things are absolutely, just around the corner. But I must say that all what we are talking about is going to be good for the community. It's going to be good for the profession and going to be good for the community also, because the kind of the disease pattern that we are seeing is all changing now with aging population and lot of chronic diseases, loneliness, mental health issues. So different kind of problems will of course emerge and will happen. But one of the focus will be to somehow make healthcare safer. Something that Hippocrates talked about 2500 years. They made us take an oath that first do no harm. But even today, harm during the healthcare delivery happens. And I think that is something with all these kind of new technologies and everything, I think a lot of it is going to come under control, but something new will start, of course, emerging. So I will say that on the whole, it is going to be quite good for the community. Excellence, I will say, in healthcare, which has been sporadic. Today also, you get excellent healthcare, but you also get very poor healthcare. So what we expect in the next decade, that excellence should become more of a norm rather than an exception. Everybody should get a consistently good, safer care. And therefore, we need to still understand that the future of the healthcare is not going to dependent on only on the machines. Still, I will say that the human factors, the leadership to deliver good care will be important. So technology may transform healthcare, but trust will always remain the most important currency, I think, as far as the healthcare delivery is concerned.
Yeah, Dr. Vijay very well mentioned because looking at the current situations and the healthcare which has been transformed over a period of time, a statistic from the McKinsey which estimate the AI could generate almost US dollar 200 to 300 billion annually productivity gains the healthcare, while WHO estimate nearly 80% of the chronic diseases are preventable through lifestyle and the modification of early intervention. Very well said. Moving on to the second segment, how can a leader balance innovations with quality and the patient safety? As you have been a leader, you have been a president, I'm sure this definitely can add your experience on this particular insights.
So, first of all, I'll say that let's understand innovation is any idea or even a change of process or a product that can transform the way we deliver healthcare in a very significant way. So what innovation does, that it does not bring about incremental change, it can bring about a huge change just by implementing a particular idea, process, and anything. So first of all, I will say that most of the leaders sometimes are very reluctant in embracing innovations, and those innovations come from within their own organization. The people in the front office, the people in various departments can come up with new ideas and innovations which can change the way healthcare delivery happens. So I will say that innovations, let's say there are innovations which are going to be, which I can call it internally, which can be seen within the hospital. And now there is a very important group which can be a vendor driven innovations or externally driven innovations, which is now something that lot of the people are coming knocking at your door and saying that, all right, whether this technology, that this solution that I have brought, this is how I can transform healthcare. Now that's where it is very important that, first of all, again, I'm saying that the leaders should be very keen to embrace technology, very keen to embrace innovations. But when we are talking about these vendor driven innovations, we need to be very, very careful that, and we need to always ask a couple of questions that is it something that the problem it is going to solve. Sometimes technology for the sake of technology or innovation for the sake of innovation has no meaning. So we must understand what is the problem it is solving. Is it not creating any harm within the hospital? Is it safe? Is it bringing value? Is it scalable? Is it okay for my staff? So all these questions, and therefore I think some of that have to be done on a pilot basis, on a very small scale within the hospital. You don't have to go on and put it across the hospital and expose yourself to some greater amount of risk. And that is where I'll say that in today's date, a cross learning from other hospitals, another is not that you don't have to learn about each of the product within your own hospital. There are other hospitals who may have used it. It is that particular knowledge that needs to be shared, and that's where organization like ours, like Kaho, it has become like a movement, because that we are allowing the hospitals to share their best practices. We allow their hospitals to share what they have implemented in the last 1 year, and we do it in the form of our annual event, Kaho Tech, which is going to happen this year also in November and AMTZ. So I feel that innovations are extremely important and they should be embraced, but with caution. And therefore, the whole purpose of innovation is to make healthcare safer, more efficient, and better.
Very well mentioned. Of course, the clinical judgment, there is no second thought. That has to come with the qualified healthcare professionals. AI can become an important part of our life, not only just to help us with the logistics operations and some of the repetitive tasks, but when it comes to the important diagnostic evaluation criteria, it has to be handled by the healthcare professional and that qualified one. Very well mentioned. So, as we have a Kaho Tech, as we have a number of initiative has been taken by care by the Kaho. You have been, representing and you have been leading the team across the India. I must say that. The moving on to the third, where will AI create and the greatest value for the patient and the clinician? Because as you know, today's physicians spend enormous amount of time in documentation and administrative work. So, what is your insight when it comes to AI creations with the patient as well as the clinician? Over to you.
So I feel that AI is going to make definitely a very important contribution to the healthcare delivery, but and it will happen in a very quieter way. I don't think it will be like a very dramatic thing that is going to be happening. So first of all, what it will do is to help us in the early warning and prediction of the problems that one can see. So catching deterioration early, sepsis, risk management, etc., will happen with the help of AI, taking the weight off the clinicians, especially as you mentioned about documentation, summarization, smarter triads, so people are not drowning in charting, diagnostic support, helping in radiology and pathology like a second reader, prioritizing, whatever needs to be seen much earlier, smarter medication alerts, I'll say, and even on the operational side, whether capacity planning, OT scheduling, infection surveillance, supply chain, all these things, of course, will happen. But I feel that AI will, what it is doing also is helping in democratizing knowledge. It is making everybody understand even complex things can be now understood at a level and in a language that a patient or a doctor, even across the specialties, whatever you wish to understand, is very important. And I think that AI should free up the time of doctors, etc., so that they are not constantly looking at the screen, which is a common kind of a thing that you think that that will happen. On the contrary, you should have more time to communicate and talk to the patients, etc. I will say that the greatest things about AI is also now, please understand that what was happening before AI, when we were using technology, so if you were getting deterministic responses, so you ask something in the computer, and if it is 2 and 2 4, you were comfortable, even they were very complex problems and the computer was solving it, or you are asking something but the answers were deterministic. But with AI, what becomes uncomfortable is that the responses can become non-deterministic, and that is where you require validation. That is where the importance of that, that AI can hallucinate, that it can also create wrong kind of answers, and therefore in healthcare it becomes extremely important that we have to treat it with caution. Also, I'll say that the other thing that AI is going to do is to connect, I will say, various data points. So, like just yesterday, somebody had come and shown me that every patient has now data, whether of his X-ray or from the wearable or from his continuous glucose monitoring, his weight, etc. So they are creating a digital twin of this every person. They say you can create a kind of a digital twin. This digital twin data will help a clinic to send him reminders or to talk to him, and therefore all that waiting time and all can go, and the digital twin can be approached on any given basis. Also, I will say hugely, for example, the introduction of algorithms and AI is changing, I will say, the healthcare delivery. So, for example, I'll say that we came across an organization which came to us about a few years back, and there they talked about uh, non-contact automated vital signs monitoring. That means a small patch of a a sensor pad was being kept under the mattress of a patient, and it could be giving the nurses and everybody a respiration, blood pressure, pulse, etc. Now, we were very surprised as to, yeah, how are you doing all this? So these were three gentlemen from IIT Bombay and Indore, and they were working with F1 formula race, and they were, studying the health of the car by the vibration of the car. And they realized that even human body's vibrations can be measured by this ballistocardiography. And that vibrations, why don't we see that if it has any correlation with the pulse, respiration, blood pressure, etc.? And I think the kind of hit a jackpot. They did it. We validated it in a couple of our hospitals, and today more than 15,000 hospitals within the country are using. And with that, now more companies are coming, and very soon I will say that every 4 hours or 3 hours a nurse goes and takes a pulse and respiration and temperature of a patient. All that is going to become a thing of the past, and so that nurses were doing in a robotic way, and so many times the things will not be even accurate. So patient's moment he moves out of an ICU and goes into the ward or a HDU, you see, he was quite vulnerable. And what has been seen is that the incidence of sudden death, incidence of code blue has gone down by 80 to 100% in patients who were now using this technology. So that's how there is a power of AI which is going to come into various aspects of the healthcare delivery. However, again, I said it all requires very close supervision. It may create more problems in certain cases, and that all has to be seen and judged.
Very well mentioned, and an amazing example which is given, and statistic which even says that the AI actually can reduce to 20 to 30% of the healthcare professional work, which is might be an administrative part that can be definitely taken care. Sir, you have been an experienced pediatrician. You have worked across. You have seen the working cultures with the medical and the clinical industry as well. So moving on to the clinical aspect of it, how do leaders create a culture of innovations without compromising safety in clinical segment? Over to you.
So I think this important thing is, please understand that buying technology is very easy, but developing the culture of safety is something that we all have been struggling for the last so many years, and that is something which has to come up definitely with the kind of leadership you require. That let's understand that over the period of years, what has happened for developing a culture of leadership has been, at most, the most hospitals have been undergoing the process of accreditation to kind of see that whether things are. But we have seen world over that accreditation alone has not really helped in working, and has not delivered and not helped in developing a culture of safety. So I'll say that the reason is that the accreditation process has been sporadic. It is only a snapshot of what happens in a hospital in any given time. It's a myth that technology can change all that. Nothing is going to change unless safety becomes, you are obsessed with safety, unless that becomes your moral compass, that every healthcare interaction must be very safe. And for that, for example, at Kaho, we have been recommending that institutions should be accreditation ready every single day, not on the day of the appointed inspection. That your behavior on the days of inspection is very different, and after 1 month it becomes very different. So you should be inspection ready, you should be accreditation ready every single day. And even that is not enough to my mind. You have to become a high reliability organization. You can only become a high reliability organization when your focus on every clinical department and function will ensure that the quality is embedded in the functioning of every department. Today, so many times the hospitals feel that delivery of quality is the job of the quality department or the quality professional. But quality in cardiology cannot be practiced by anybody outside cardiology. All the issues, whether there is a delay in the diagnosis in a cardiology patient, or there is a wrong prescription, whatever has happened, is all something that we need to introspect. And that is where every person within the hospital ecosystem, whether they are doctors, nurses, engineers, pharmacists, dietitians, rehab specialists, technicians, supply chain people, everyone should understand the good practices first of all within their area. They should understand how can technology improve the functioning of their area, how can innovations help in improving the functioning of that area. And that's where I feel that we will be building a culture of safety. And then I will say technology is only an icing on the cake.
Yeah, absolutely. Very well mentioned. Most of the healthcare are the unique innovations, and I still remember when it comes to the clinical, evidences. When it comes to the clinical setting, it is very important that we should move with the speed of evidences rather than just an enthusiasm. As you really mentioned, that we have to be ready every day, not on the just day of the accreditation and on the day of any kind of evaluations are happening. Very well mentioned. Moving on to the. We have to break down certain things now here. When you say that patient who do not experience healthcare in silos. So my question goes to you: how can a healthcare break down silos across the disciplines? Over to you.
I think that's where I will say the leadership and all the aspects of leadership become extremely important, because the patient has, patient just comes for a uniform journey. But we have created departments, we have created specialities. So this is our kind of doing. Patient is not something that he is asking for. I be seen in this department or that department. We have created that silos. How do we kind of bring a coordination? A lot of it is an issue that, first of all, even at an organizational level, a lot of hospitals do not pay emphasis to their own vision and mission. That vision and mission must align with every department, with every function. If a person who is working as a billing clerk, or person who is admitting, or a doctor who is treating, is not aligned to that vision and mission, then you are not going to be able to break all these silos. So there are a number of ways that in which you will do it. Of course, the departmental excellence metrics are all important, but on top of that, you need to see that the whole organization works like an orchestra, and where the top leadership needs to work in giving space and creating leadership at all levels. You require distributed leadership, as we say. We require that those leaders are given the kind of power to change things and align it to the hospital's ethos, to make sure that I'll say that every patient who comes very typically, I'll say, is that, let's say, in majority of the hospitals in which I've worked and everything, I'll say that hospitals work on solar energy. Moment it comes night, from 7 p.m. to 8 p.m. to morning around 5 p.m., 5 a.m., you find that most patients are vulnerable. So in some of the hospitals that we worked, we created a kind of a system of mentors. We stated that senior people will take rounds later at night, and whether the patient is of neurology or cardiology, at least they would be listened to. So one has to create kind of interdisciplinary rounds, structured handoffs, shared dashboards with kind of information which is flowing from one side to other. And so I think that's where leadership and the leadership of the past is not going to work. It's a kind of a leadership where you don't require experts, but you require people who should be asking the right questions, should be, as I said, making leaders in various departments. And that can help you breaking the silence.
Yes, absolutely. Very well mentioned, Dr. Vijay. When it comes to the leadership, of course, there are ways and there are different methods of leadership, right? But the challenge come where even the visionary leader is looking forward, to how to help and support his team and how to build up that culture. It is not only just a primary, secondary, and tertiary care when it comes to even the multidisciplinary approach, as you rightly mentioned. When it comes to the digital adoptions, we already spoke about the digital adoption is very important, which is a need of an hour. And of course, in India, healthcare system is growing slowly. Like, okay, when you say about the urban versus the rural, urban has a many chances. The scope is more. People are literally helping, supporting, and the companies also coming forward to take these adoptions ahead. Now, as per you, what separate the digital adoption from true transformation? Your experience on this?
So digitization itself is only making a paper into a screen. So must understand that digitization per se does not change anything. Okay, unless you improve your processes, unless you improve your care delivery pathways, you can digitize and you will imbibe the same old things that whatever you were doing earlier. So digitization is one thing. Then you find the second is whether the people in the hospital are they using those tools that the hospital has invested in. And third is that whether my workflows, decisions, accountability, all those changes, have they changed or not? So digitization is a very great need and very important because it is giving me the data on a dashboard. It is giving data to the people, but we have to train our workforce. Buying the software, buying a particular tool is important, but equally important is training the workforce for making, I will say, meaningful outcome of this particular application. So digital transformation, I'll say, is ultimately also about trust. Clinicians must trust the system, patients must trust that my data is safe within this system and hospital, and leaders must trust that this information on which they are going to take decisions. Because if that trust is not there, things are not going to work. So, and for me, the practical test is it reducing the harm? Is it making the healthcare safer? So, I think it's a journey. And towards that, I think all the government initiatives of the ABDM and NHA, we are still reluctant to, they are not being embraced at the moment. So we need to kind of work towards that. Lot of digital public goods need to be more developed so that this can become more widespread and digital adoption can start delivering what it is supposed to deliver.
Yeah, it's really important because transformation is about not only changing the system, processes, and the culture, but it's very important how a person sees each and every processes, which really become a part of their day-to-day life as well. So when it comes to the leadership capabilities, what do you think that what will define the next generation? Because definitely there is a change. Definitely there is a different culture, different belief, different system. And when it comes to even somebody's choosing an MBBS and somebody's choosing the higher studies, that does matters. So what would be your insight on this? What leadership capabilities will define the next generation? Over to you.
So first of all, I'll say that by training, most of us become managers rather than leaders. So we do not even understand the difference between a good manager and a leaders. So first thing is to really understand the various aspects, and therefore, by and large, people who were put in a position of authority were de facto leaders. But that's not what is leader. Leadership is not an issue of authority. Leadership is an issue of your ability to influence people in an ethical and pragmatic way to start following a common goal and a cause. And for that, I think each individual must kind of learn certain basics of the leadership traits which are required and which are very different from being a manager. You need to be, of course, a good manager. But for being a good leader, you need to first of all lead yourself. You need to work on yourself for your own discipline, for being your own awareness, handling your own emotional issues. So, what we call as lead self, you need to be able to engage others. You need to develop coalitions. You need to achieve results. And you need to be able to do a system transformation. So, in fact, it is on these 5 principles of lead self, engage others, achieve results, develop coalitions, and system transformation that we run the program called LEADS, which is with a Canadian group to train people for leadership. And over a period of time, therefore, hundreds of people in various departments and all are being trained. So, very, very important is also to understand that healthcare delivery is a very complex thing. Healthcare delivery is not that simple as probably it used to be maybe 70, 80 years ago. So it's a complex adaptive system, and there is a complexity theory I will say divides problems into simple, complicated, complex, and chaotic. And most of the healthcare delivery comes into the complex system, not even complicated. Like getting accreditation is complicated, but it is achievable. But developing a culture of safety is complex. So you require, therefore, a leadership which is of system thinking, which should be of humility, which is a what we call a servant leadership, distributed leadership. And as I consider, a leader should be like the heart of the human body. So, while it is critical, but all the attention is going to the face and the hands and your eyes. But as a heart, you are giving nourishment to every part of the organization. So that's where you require leader in every department and in every function. And that's what can help.
Absolutely, very well mentioned the capabilities. Obviously, systematic thinking, as you absolutely have added the value when it comes to the AI literacy, data-driven decision making, ethical leadership, adaptability, collaborations, emotional intelligence, crisis management, and the continuous learning, go-getter attitude, which can be really, the attributes we can really add up. Moving on to the AI-enabled world and the patient-centered care. So, how will a patient-centered care evolve in an AI enabled world? What is your view on this current status?
Yeah, so as I said, that is in fact, one of the major drivers of the healthcare and AI and digitization is the patient centeredness. So today, the community and the patients, as is happening even in the other segments of life. So today, for example, when you are traveling, the kind of help that you required from many other things are not there. I am on my own. I am able to uh, book my own journey. I am able to book the hotels. I am able to see where all I have to go and visit all those places. Even so, with the advent of AI today, people who were doing coding, now person who has no knowledge of coding is able to do coding. So even very complex kind of things are being understood, and that's what is going to happen or is happening even in the healthcare. So I will say that first of all, the sometimes important thing is that AI should not distance us from patients. Done right, it should bring us closer to the patients. We should not be afraid of this patient coming with a certain amount of knowledge which he has gained from the internet and everything, and the doctors may feel. I think the time has come where we need to kind of give that kind of a space to the patient. We have to make them a partner in our healthcare delivery. So, in fact, I'll say that if AI does not increase the dignity and the trust for the patient, then it is not progress, no matter how sophisticated it is. So, in fact, so look at almost anything, whether a patient needs today, let's say for diabetics, even there are things like continuous glucose monitoring patches which are being applied, or people are putting their Fitbits, they know how to keep themselves much more healthy. So I'll say that AI and digitization is going to be making healthcare patient centered. Even remote monitoring will help the patient getting the care right at his doorstep, right at home. So there are a lot of instances where we have heard that how patient, when he was wearing a wearable watch or something, got an alert, reaches the hospital in time. So I will say that patient centered care in this AI world is the main driver, I will say, of this entire technology revolution.
Yes, absolutely. When it comes to even the technology also should help to the, as what challenges we face, but it should never replace a compassion that only comes with a therapeutic touch, not anything else. Moving on to the strategies. So according to you, what strategies build the resilient healthcare organization? As you have seen the COVID-19, as we have seen the number of incident where we have required a task force, so what is an important strategies to be incorporated?
So, first of all, is to understand that resilience is not toughness. Resilience is how fast you learn, how prepared you are for a unexpected event. And that's where, for example, COVID was, of course, a great opportunity, great example of testing. Every organization was tested for their resilience. And therefore, the various kinds of mock drills, etc., that we say, for example, you don't expect a fire to happen and then the hospital is going to respond, how well they will respond. So mock drill, to expect that sometime there may be a surge in the capacity. Certain times you suddenly see the hospital may have 90% occupancy versus a 50% occupancy. How well are they managing those kind of issues? So it's an issue again of, I will say, leadership, that how well we protect patients under the adverse kind of circumstance, under stress, how you are doing it. And so therefore it kind of includes even today, even preparedness for climate related disasters, pandemics, as we have said. Cyber threats is another thing that has to be talked about in today's date. That is very important, that as we are thinking of more digitization, then these cyber attacks are happening. People need to be kind of prepared. Supply chain disruptions have to be looked at. So healthcare organizations must be able to not only survive crisis, but to manage stronger, because they need to learn from them, from every of that episode.
Yeah, absolutely. Leader must invest as much as in the people as they invest into the technology, as you correctly and been saying again and again. Now, moving on to one metaphorically questions where if you could redesign an healthcare from a blank canvas, what would it look like?
That's really something, because it becomes like a dreamer's issue as to what can I dream. So I will, to my mind, the primary care has to become the command center. Today, that is what we are lacking. So primary care, prevention, chronic care, outreach, they should become the central point. The whole payment system should be based for value driven healthcare delivery, not the volume driven healthcare delivery. So that kind of needs to happen. patient safety has to be a very integral part of whatever we do. Alternative systems of medicine have to get much more, I will say, space. Sustainability has to become a very important part of our the way we deliver. At the moment, we are contributing quite a lot uh, to the global warming. All that needs to kind of be understood. In spite of technology, I will say equity and compassion, they need to become a very integral part of the healthcare delivery. This is a topic in which I think we can go on for a much more time. I think the time is not going to permit us, but basically what I'll say is that the primary care, and to see that the equitable our rural people are able to get an equal amount of good care, a lot of things can be put in place.
Yeah, definitely, and absolutely, it's going to be a big vision because, as you say, when it comes to the urban and the rural area of the populations, okay, whatever said and done, the rural area also required much more attentions when it comes to the primary, secondary, and tertiary, facilities to be provided. Moving on to the every technology brings the challenges, the misconceptions, and the issues as well, right? So, according to you, what misconceptions about AI and the leadership we must overcome?
So one I will say is that buying technology equals transformation is not true. So no transformation is going to alter your workflow, or it is not going to help you developing a culture just because that you have invested into a particular technology. So that's very important. More data means better care. That also is, we have to understand that unless that data is uh, you know how it is curated and how it is analyzed, how it's being used. Otherwise, more data can be even more confusion rather than better care. So the issue is that AI, as we said, is non-deterministic. It can hallucinate. So the risk is ungoverned AI. So leadership and governance is needed so that the AI can be used for better use for the healthcare delivery, I will say. So other thing is that whether technology is expensive. So I always feel that the poor quality is far more expensive than investing in technology. So I will say that with this.
Okay, perfect. Makes sense. You have been working across the industry. You have a huge experience. So, what three lessons would you teach every emerging healthcare leader?
One is to make safety non-negotiable. I will say something that we owe it to Hippocrates, as I said, for 2,500 years. So I will say that patient safety should become very important. Second is that we need to invest in our healthcare workforce, build teams. So heroics don't scale; it is the teams which are going to, deliver. And I will say that basically thinking about patient centricity and different things that we have talked so far are all to be woven, and don't think that you can deliver anything alone within your organization. You require your team, you require your people. So work on them, work on embracing technology in a sensible way, and keep patient safety. So I will say patient safety, technology, and team building.
Yeah, absolutely. The last question I would like to ask, it's nothing but to complete the sentence. The future of the healthcare belongs to the leader who are any insights on this?
By making healthcare reliable, safe, and compassionate.
Okay, that's really really amazing answer. I must say that. Now we are coming to the end of the sessions. However, there will be a couple of questions from the participants as well, which I will be asking you. But before that, we can have a rapid fire. Okay, so stay tuned, Dr. Vijay. Okay, now one word that defines the future of healthcare.
Safety,
Okay, that's nice. Second, what is the biggest leadership skill for the next decade?
humility.
Okay. One technology that will transform healthcare the most.
No single technology can transform healthcare.
Okay. Okay, that's really nice answer. I must say that. Okay. One habit every healthcare leader should practice daily.
To be able to listen.
Oh, wow. That something is really important. And somewhere, whenever we talk about the listening, that I think that itself can, create a series of the event for the podcast, I believe. Okay, so there are a couple of questions. I can take it from the, my chat, my personal chat I have. Uh, I would, uh, I would like to ask that. What inspired you to pursue the leadership in the healthcare? There's one question from the Indore.
What inspired me to pursue?
Leadership in healthcare.
Okay. So I don't have a very logical answer to that. I was put into certain positions of, running even a small hospital, then a little larger hospital, and therefore I will say that it is that responsibility. And I think one of my traits has been to take people along with me. And once you are taking people, I think very early I understood that in healthcare, if we are together, if we share our problems, if we share our journey, and another thing that I understood was that being a doctor did not trained me for being a leader or for running an organization. So it was important for us to listen to other people from other industries, whether it was from law or from hotel industry and everything. So when we brought these people together and we invited these people to give talks, and because I was into that kind of a position, I think each of that thing kept on inspiring me to, I will say, keep on going to the next step and taking this particular journey that we need to deliver safer and safer healthcare. How can we become less vulnerable? Over a period of time, the whole healthcare delivery, or I would say the professionals, have become disillusioned because of the kind of stress under which we start to live. So I'll say overall, it's a very complex kind of a process and journey that helped me reaching wherever I have reached.
I must say that that's really impressive because it takes a zeal, it takes a passion to be where you are at this moment. You have been a leader, you have been a healthcare strategist, you have been one of the renowned personality, and it's really matters a lot. There is a one question from Dr. Pathak. He says that how can an healthcare become more preventive than the reactive?
Yeah, so I think that these are all issues that where they have to be ingrained within yourself, in the sense that today I have seen that even in a kind of a gathering, if I ask a group of about 100 healthcare professionals, doctors and nurses, that how many of them have received a flu vaccine, and only 5 or 6 hands go up. So unless we start practicing prevention internally, we start understanding the importance of it, then we start understanding the importance of it for the patient. We have to lead by example. We have to, definitely, I feel that's a very important area, as I said, and it is going to come up, as I said, in the next decade, much more, that the prevention has to become a problem, has to become a very important thing. Even for the government, you have to understand that not having safe drinking water Today, there are many countries where you can go and drink water from the tap. I wish we can do the same thing in our country. And you see the amount of diseases that will get reduced, see the amount of the disease burden that will get reduced just by doing this. Good practices or good initiatives like the sanitation and all is all part of the prevention, I'll say. So that's a very huge area. Even roadside accidents, following a kind of this thing, taking care of those things, cessation of smoking. So there are so many areas where some work has been done. There are areas where, again, the society has to do work more. And there are areas where we as individual doctors can focus and do much more on prevention rather than only on cure.
Absolutely, very well mentioned. So this is the last question from Mrs. Smita, who's from Quality from Mumbai. She's asking a question on the mental health, basically, on the workforce and the culture. So how can a leader create a psychologically safe workplaces, and what skills are required for the professional to develop?
It just requires, number one, a leader to understand that things can go wrong in a system. It requires, if a leader is there who is going to shout at that, I don't want to hear, I mean, that was your job. Why is this problem is coming to me? Then you are giving a signal that all the kind of bad things happening anywhere else should be swept under the carpet. So, moment you start celebrating a near miss, moment you start giving importance to problems which are coming to you, treating them as an opportunity to improve the systems in your hospital, I think that's where you will create a psychologically safe place, and which is very, very important. Even I should have mentioned for embracing innovations, because when you embrace an innovation, and sometimes you may be so sold out to a particular technology that you don't want to hear anybody talking a negative thing about it. That's not right, because that's where you will kill the right kind of learning things happening within your organization. So that is something which has to come from leadership, to understand that we should be very open to listen to the problems and then work on system. We have to understand, slowly we have to understand that initially we used to think that if there is a problem, it is the problem of an individual. That individual blame and shame does not have much place in today's management. We have to see as to why that problem kind of happened, learn from it so that we improve our system. That's what will be needed.
Absolutely, very well said. Thank you so much, Vijay ji. And we are coming to the end. As we conclude, one message which stands out really well. The future of the healthcare is not about just a smarter technology. It's about the better leadership. AI, digital transformation, and the innovations will definitely reshape the healthcare. But the quality, patient safety, but only the standard that really remains with the ethical compassion, the patient safety, and the equity must be remain as a part of every decision. The leaders who defines that the next decade, all those who will embrace a change, empower their team, make the evidence-based decisions, and always keep the patient at the center. Technology may not transform how we deliver the care, but humanity will always define why we deliver it. I would like to give a vote of thanks on the behalf of Power of Knowing You Forum, Mr. Prem, and the JV Tech Motivation and the MedTech Insight episode 9. It's been really privileged, and it's an honor to host you and take this interview. Thank you so much for giving this opportunity, Vijay ji. It's really pleasure. It's really pleasure. Thank you for all the participations, for all the throughout engagement, and of course enthusiasm which has been mentioned. We have a couple of many more questions, but as a time constraint, we will not be able to do it. But definitely, let's leave us today with the shared.
You can share those questions with me. I'll be very happy to
Definitely,
interact.
definitely, definitely, Vijay. I will share you the questions to you on the email ID. And let us leave today with a shared commitment to lead with innovation, integrity, compassion, and excellence as we shape the future of excellence. Thank you once again, everyone. It's a really privilege to have you, Vijay, and once again, the team are at JV Tech Motivation and Power of Knowing You. Thank you so much. Thank you.